The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Hello audience, welcome to Dr. Fazil TV show. Today we are going to talk about the causes of low back pain and what we can do in our daily life to get rid of the low back pain or avoid it altogether. Again, this is Dr. Fazil TV show and this is April 2022 episode. So first let's talk about what is the different causes of low back pain. So low back pain is generally in your lower back, or you can see the spine right here. So let's talk about the anatomy of the spine. So in spine, we have the cervical vertebra, which is the neck area, the thoracic vertebra, which is the mid portion of the thoracic spine, and then we have the lumbar vertebra, which is the lower part of the spine. Now remember, the pain from the lower back could be from multiple sources. It does not have to be just the back alone. It could be a referred pain, it could be a kidney pain which can come to the front, or it could be a pain from the hips, and sometimes it could be from the shingles. So I've seen some cases where patient has been complaining of pain and you might not have a full-blown shingles, like a rash of the shingles, but like a subclinical shingles where the rash is not there, but generally the pain is there. So pain travels in the pathway of the nerves, and it can also cause pain in the back or in the front, but it's generally on one side. So we have to be careful when we come up with the diagnosis of a low back pain. Low back pain is just a syndrome. There are multiple reasons for low back pain. The low back pain is most common cause of outpatient visits in the USA. It's definitely a huge burden on the health and huge inconvenience, concern for the patients on a daily basis. And also it is one of the most common cause of absence or unable to perform work or being absent from the job. So let's talk about the back pain today. So as I said, the back pain has multiple sources, and sometimes you don't have to have one source alone. You might have multiple sources working all together at the same time. We have a skeleton. You can see that we have a back pain, a lumbar spine. We have the joint known as sacroiliac joint. There's the hips on each side. So the pain can come from, and then on the top there's the skin. So pain can come from the kidneys here, the skin caused from like shingles, or referred pain from a pinched nerve, hips. They can also refer pain, and then a kidney stone or blockage in the kidney can cause, or infection in the kidney can cause back pain. And then inside the back by itself, there's so many other sources which can cause to generate pain. We call them pain generators. So for example, a pinched nerve. The pinched nerve could be due to herniated disc. Now before I go further, let's talk about the anatomy of the spine by itself. Now spine have vertebrae and disc, and each side of the vertebra and disc there's a hole from which the nerve comes out and it runs down to your legs, and if it is pinched at that level, it can cause radiation of the pain all the way down on the back of your leg. So the leg pain could be due to the back pain. We call it sciatica. It could be right side or on the left side or on both sides. How would the pinched nerve happen? It could be due to herniated disc. So disc by itself can be herniated. Like you can see here in this example, the disc is like a little, like a disc. This means disc, and it is being herniated, or there could be a tear in the disc, and the whole disc could be herniated with the pulp coming out and touching the nerve. Sometimes you can have a bone spurs which can be touching the nerves, and then also between each vertebra we have joints, and those joints can cause also pain due to arthritis. So vertebrae can cause pain by itself, just like any other joint arthritis, it can cause pain. So the low back pain from spinal cord alone could be due to pinched nerve from bone spurs, disc herniation, arthritis of the joints by itself between two vertebrae. It's really important for a doctor or your provider to differentiate the source of the pain, because unless we diagnose the pain source, we cannot fix it. So it's good history is important, physical examination, and generally the treatment of choice is MRI. X-ray will show you, for example, if there's any fracture or dislocation, which is rare, but it's possible. But that's the initial diagnostic testing. And then second step would be an MRI, which is more for visualization of soft tissue in the spinal cord or in the vertebral column. And then the last test might be the CAT scan, which is only used if MRI is not available, or patient is claustrophobic, or patient has a pacemaker or another devices in the body which cannot be exposed to the magnet, for example, pacemaker. If the source seems to be kidneys, then abdominal sonogram would be the next modality, where you can rule out if there's any stone in the kidney or blockage in the kidney. If there's any evidence of infection in the kidneys, then the urine test would be a good place to start with. And then a good examination of the skin as well. Make sure there's no shingles coming up also would be a very good idea. In addition, there's some specific examination which provider would perform on your back. But with the history and physical examination and MRI or other imaging modalities, we can pretty much come up to a good source of diagnosis.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
The treatment. So the treatment, as I said, depends on the source. So let's say the source is, as in most cases, is the back pain, a pinched nerve. Initially, NSAIDs or ibuprofen, morphine, naproxen, Tylenol might be a good place to start with. Some stretching exercise might help, but we have to be careful. If your kidney functions are low, you cannot take medication like ibuprofen, morphine, or Aleve. If you have liver problem, you should stay away from Tylenol. So local heat might help a little bit. Some muscle relaxer might help a little bit. Most acute pain goes away over a period of time by itself. However, the chronic pain, the pain which has been there for months and years and is causing impairment in the lifestyle, and the pain which is radiating to the back of your leg, we might have to use other kind of modalities. For example, physical therapy, where they do traction of the spine, and it might help to reduce the pressure on the pinched nerve, or a medication like gabapentin or Lyrica, we also call it Neurontin. That can also help to relieve the inflammation in the nerves. Now remember, gabapentin or Lyrica is not a pain medication. It is just it is a medication which is supposed to reduce inflammation in the nerves. It has side effects though. It can cause sleepiness and sometimes confusion. So generally the trick is to start at very low dose. Ask your provider before you being prescribed this medication or you start this medication. The next step is obviously, yes, let's talk about inversion tables. So people do ask if the inversion table is a good idea. As you can see, it's the inversion table, and the patient is hanging upside down. It might help, but most likely wouldn't, because to cause traction on the spine, you need a lot of pressure. And with inversion, you're just using your body weight. It is not enough to cause the traction on the spine. Spine is a very strong body part, so just a little inversion might not give you all the help. It might help to some extent, but not the best results. So the best results would be professional physical therapy, that might be able to help. Then obviously the core exercise of the back might help as well to build up the muscles to prevent back pain in the future. So if your muscles are strong at the core level, then you might not have direct effect of your weight or trauma or lifting on your spine. The muscle would hold that jolt initially, so the spine is protected. That's more for protection. But if you already have back pain, then we have to go to the next step. Injections of different kinds are available for reducing the inflammation. For example, epidural injections. This injection, you can see the epidural injection is the injection which goes into the spine. Sometimes the trigger point injection helps. Now, generally speaking, we have seen that when we fix the back pain by those modalities, then patients generally come up with another kind of pain. For example, hey doc, my pain is gone from the back, but now I have the pain on the right side or on the left side of my hip. So what has happened is that the body generally perceives the most severe pain, and the less pain is generally ignored. In that case, what happened is that we fix the most severe pain, which was the back pain, by whatever the means might be, medications, physical therapy, or injections. Then the underlying less severe pain from the hip or other sources start to appear, and then we have to deal with that pain separately. So that's the reason people start to get a different kind of pain after the main pain is taken care of. So the other modalities are available. For example, as I said, pain medications, which we try to avoid it because they are addictive and they are not, on the long haul, they are not very effective because body gets used to it and they have side effects. The next step is obviously surgeries. Now, surgeries are very not idealistic approach for treatment of back pain. We generally recommend, if everything has been failed, everything which we have tried initially, as in my initial discussion, then we move forward toward the surgery. The surgeries are have such a high failure rate that we call something known as failed back syndrome. Up to 50% of surgeries might not help your back pain. That's why we have another syndrome known as failed back syndrome. That means your surgeries are so unsuccessful that 50% of the patient does not get better from the back for the back surgery. Now, do remember that the neck surgery have a lot more higher success rate than the lower back surgery. Let's talk about another modalities. We have another modalities, for example, pain stimulators. That's something new, not very new, but has been used lately quite a bit, where they actually cause a stimulator device in the back, and patient can trigger that machine or device when they feel pain, and it actually overrides your own pain, and the body get confused and they receive just the stimulation from the nerve stimulator. So that's another, if it is done effectively in the right fashion, in the right setup, then obviously it will be a very good way to control the pain. So we talked about different modalities for the pain in the lower back. As we said, NSAIDs, ibuprofen, levothyroxine, Tylenol, local heat applications, stretching, and then obviously doing injections, steroid injections, and then the last thing is obviously surgery and chronic pain management. But chronic pain management should be avoided at most cases, because again, it has a lot more side effect than any benefit on the long run. Surgeries is a last option. It has 50% failure rate. One more option is you can see here how the pain stimulator works. You can see the patient is pressing the button. The electrical pulse is going to the brain through the spinal cord, and it overrides the patient's own pain source, and that pain go away. So that might be another option to consider. The best thing is to prevent any trauma to the back. Do some core exercise to build up the muscles of the back. When you lift weight in such a fashion that you're lifting weight with your knees and keeping the back straight, and not bending forward and leaning backwards, because that will cause crunching motion on your back. That would be a preventive approach to avoid pain in the lower back. Anyway, I think we have discussed the most common source of pain. The last but not least is as I said, is hip pain. If you have also pain from the hip that is dealt differently, we will talk about that in a different session. It's a lengthy session, but most of the time the back pain would be from your lower back, from vertebral column, and if we can avoid the pain at the first place or fix it with the conservative treatment, that's the best way to do it. So, as I say, please watch your back. And again, it's Dr. Fazil Show, and I will be back in the next episode with more information. Please stay safe, and God bless you all. Thank you so much.